Good afternoon, everybody, and welcome to another edition of Wellness Wednesdays. Trying to say that fast 3 times. I'm Pat Cameron. I am the Director of Family Ties at the Federation for Children with Special Needs, and it's a project that's funded and co-managed with the Department of Public Health. I am here to celebrate Wellness Wednesday with you, and as you heard from the governor, we're extending the stay-at-home order until May 18th. And in many communities, it is now required to wear a mask outside the house. And so I really want to talk about, how you can go about making your own mask very easily and making them for your children. It's advised that any child over 2 wear a mask as well. And this is if you're riding your bikes, if you're, out walking, and particularly if you're out going to the supermarket or sharing the street with other walkers and so forth. So I really want to just share some simple strategies with you, and as we go into this for the long haul. So we will be continuing to practice social distancing even when we are back to work, is what I understand, including wearing masks in the work environment, which is just being put out there now. I don't know if that'll actually happen, but I think we should, sort of prepare for all of that. There have been lots of how-to videos available on how to make a mask. One is using a bandana and folding it multiple times, and then, using hair ties or rubber bands on either side to put them, behind your ears. I find that very uncomfortable. And particularly, thinking about if you're a person who wears glasses, if you're a person like my daughter who also has hearing aids, putting anything behind your ear, along with everything that's already behind your ear, can be very uncomfortable and cumbersome. So I've actually gone into, the pile of clothes that I had ready to donate because they no longer fit or anything like that. And I literally cut a section of the sleeve, around the bicep area. So it's a nice broad section. It means you don't have to sew it or anything. And then using just a rubber hairband and putting it putting it right up in between in the middle of the sleeve, and then putting it up on the back of your head. Voila. You've got a mask. Simple, no stitching required, and very easy to use. I would, if I had to do it again, and I probably will, so we'll be wearing masks, I would choose a lighter weight fabric. This was a thermal, which makes it just very hot. The whole goal is you want enough layers in your mask so that if you blow, you can't blow out a candle. That's the whole thing, is to, both for your protection, if you should be asymptomatic with the virus and you can't spread that to another person, because that means your breath is not being felt outside this protection. So you really want to think about that. The best one that I have done is actually cut the sleeve off of a shirt. If I get this right. Sorry, that way. So right at the shoulder, it was a short sleeve shirt, cutting it right up. I'm going backwards here looking at my own reflection. Cutting it right around the shoulder seam so that, again, it won't ravel, it's well stitched. And then literally using that same headband, putting it up through, up on top. And then just the natural curve of that shoulder brings it down underneath your chin. This is a lightweight fabric. Oh, there we go. So it's really easy to to breathe through. And again, it contours under your chin because it's the rounded part of the shoulder, which makes it really easy. So if you have, clothes that you can part with, I really liked this summer blouse, but it's well worth my health right now and the health of people around me to cut it apart. And obviously it's got 2 sleeves. You can get 2 masks. So it was really, easy to do. And then I dragged out my sewing machine. And so this has an opening at the bottom where they suggest using a coffee filter or a piece of paper towel to use as an absorbent material in between the layers. But you can just take a scrap of material, and this is just, I'm showing you the backside, just binding tape so that you can have a mask. We get this in the right way. So that you would then, tie it up here and then tie it behind your neck and, and have a mask. Using lightweight cotton material is very breathable, because, they can feel really confining. But many communities, as I said, are now charging fines in Somerville and Cambridge, and I know Brookline is requiring masks being worn, and it's definitely the advice of the CDC when you're out and about. So it's really important that for your own protection and your family's protection, and for the protection of the people that you encounter, that you're keeping social distancing. I like to use physical distancing because we still need to be connected socially. Through the internet, through our, the phones, and through Zoom, Facebook, whatever medium you use. Because in these times, we still need each other. And, being able to protect you and your family will mean you'll have opportunities to go out and go out safely into the community. One of the ramifications that I wanted to bring to your attention to during this time is that understandably, in the very beginning, when we were all told to stay at home and businesses closed, that included pediatrician offices, and that included parents and pediatricians canceling those well child checks. And so sadly, we are significantly behind in immunizations. And so it's imperative to use, all of these ways to stay safe when we go out. Calling your pediatrician's office, calling your health clinic, and find out, when can you bring your child safely in for their next round of immunizations. The New York Times had an article yesterday where they said that in some states it's up to 80% of children missed their immunizations in March. And so we're now into April. That percentage, I'm sure, is higher. Massachusetts is 78% missed their well child checks. So again, call your pediatrician's office, find out what they're doing to make it safe to be there. They are oftentimes now, as things have evolved over the course, finding a new way to do business. And I read too that sometimes you're waiting in your car instead of the waiting room, and they're texting you to when it's safe and it's your time for an appointment. Boston Medical Center is providing a van that's going out into Mattapan and some of the other Boston neighborhoods to provide well checks from the back of their van. So it's imperative that we keep our children healthy, progress with their normal routine of getting immunizations on a schedule that the AAP endorses, and that we all stay protected, not just for this coronavirus, but for anything of MMRs and diphtheria and all of the different inoculations that kids get as part of their well child checks. We've seen a dramatic decrease in the referrals for early intervention because families aren't being seen for their well child checks. And so, as we move forward and find our new normal, I think it's really important that we always remember that our wellness is essential. And, in keeping the routines up and keeping families engaged will be really helpful. So I wish you all well. I hope that we get to see each other soon. Meanwhile, Have a wonderful day. Take good care. Bye-bye.